Hello, my name is Jian Guo Wen. I'm now professor and head of Pediatric Urodynamic Center of First Affiliated Hospital of Zhengzhou University, China. I got my PhD degree in Aarhus University, Denmark. Got my MD degree in China. I have been working for incontinence and pediatric urodynamic study in children for more than 40 years. I built the first pediatric urodynamic center in China in 2001. I became an ICS member in 2003, ICS Children and Adolescent Committee member in 2012. And later, I became urodynamic committee member in 2013. I'm now looking forward to cooperate with everyone. We together to develop urodynamic study and CIC application in children and adult. My workshop title is Clean Intermittent Catheterization in Children and Adult, from basic to clinical application. A total of 5 topics will be included in this workshop. The first speaker will tell you how to preparation for CIC. What is the indication, contraindication for CIC? The second speaker will tell you the special of CIC procedure in children and adult, as well as how to follow up the CIC patient. The third speaker will tell you the role of nursing to guarantee successful CIC in children and adult. The fourth speaker will tell you the concept of part-time CICs, or we call it morning and evening CIC, and how to use urodynamic study ordinary to guide the CIC. Finally, the fifth speaker will tell you how to prevent, diagnose, and treat the complication of CIC. It is well known that CIC is a useful technique to empty the bladder. However, this technique is not always easy, especially in children. The content of this workshop covers almost all areas of CIC. The CIC patient is not only from young age, but also come from old age of patient, the people. The content of workshop cover basic knowledge on bladder and urethral morphology and function, as well as the standard procedure of CIC, cover knowledge of how to use CIC during urodynamic study to guide CIC, determine the interval catheterization, and when begin to start part-time CIC or end the CIC. Also cover how to prevent, diagnose, and treat the complication of CIC. Therefore, this topic is particularly important and relevant for nowadays clinical practice. From the workshop, the CIC patient is come from different department or disciplinary. This patient with post-volume residual increase that is induced by different disease. Therefore, to successfully perform CIC need multidisciplinary cooperation. In this workshop, the speaker consists of pediatrician, pediatric urologist, nurse, and they will introduce you multidisciplinary knowledge to you. I'm sure that my workshop will make a great contribution to advancing multidisciplinary research and cooperation in continence care. ICS-EUS 2025 joint meeting will provide a platform to show the newest technology and innovations in field of continence. The exhibition hall and the symposium will offer direct engagement with the key opinion leaders and practitioners, facilitating valuable feedback and collaborations. The multidisciplinary setting allows for holistic learning, improving patient management strategies for conditions such as lotus, incontinence, and pelvic floor dysfunctions. As what I knew, that more than 6,000 abstracts and a lot of workshops has been submitted to this meeting. Therefore, this year ICS annual meeting will be a unique and valuable conference for researchers, clinicians, and industry professionals. Thank you for your attention.